All right, we're here with our patient today at Carolina ChiroCare and Rehab. It's Dr. Jeffrey Gerdes, your Raleigh, North Carolina chiropractor. And you've been having some lower back pain for quite some time. Can you tell us a little bit about that?
It started in 2010 and it's been very consistent every day since.
Okay, so like a constant type of lower back pain, does it ever go away?
Not too frequent.
Okay. So we're going to do our best today to see if we can get our patient here out of pain as quickly as possible. But before we do that, let's just check a couple things. We want to check her ranges of motion in her spine and check her reflexes and a couple orthopedic and neurological tests just to make sure it's okay to proceed with the chiropractic treatment. So let's see. Any back pain here?
No.
No. Okay. Let's bring this leg up here. Any back pain with that? No. Very good. Good.
That's always felt weird even as a kid.
Pretty healthy reflexes. Good. Good. So, neurologically, everything looks very healthy. You're not having any pain going into your legs or any numbness.
No.
Just back pain, is that right?
Oh, just back.
Okay. Let's take a look. Can you lean forward as far as you can? Good. Any back pain with that?
No.
No.
It actually feels a little better to kind of stretch it out.
Okay. Let's see. Come all the way back. Good. What about that? Does that hurt?
No.
No. Any pain there?
No.
Any pain there?
No.
Okay. Let's see. Let's go face down on the table. Good. So we're just going to check her hips and her sacroiliac joints. Any pain with that?
No.
Good. Any pain here?
No.
No. Any pain here?
No.
No. Any back pain here?
No.
Any back pain here?
No.
Any back pain here?
No.
Okay. So we have essentially a normal exam. Nothing is really positive, yet the patient still has back pain almost every day for the past 7 years now. So we're now going to go ahead and proceed with a lumbar and thoracic adjustment to the patient's spine. We're just going to do a quick leg check here. Good. So left leg is just a little bit shorter than the right. Let's go to neutral here. Good. Still slightly goes long. That's going to show us to go into that left sacroiliac joint, and we're going to push it up and forward to see if we can balance out her pelvis. All right, let's see. Can you lay here on your side, face me? So we're going to do the same thing. Let's bring this bottom forward, cross our arms here, relax the neck. Good. We're going to bend this top knee here. This leg, and then we're just going to, just relax your head. Good. Nice and easy. Yep.
Ooh,
Very
that was
good.
a big
Wow.
crack.
That was a loud one. Let's see. Let's go on the other side here. And we're going to bend this knee here. Same thing. And we'll cross both arms. Go here and here. Relax your shoulders back. Good. Is this where you get your pain in the low back?
Yeah.
Okay. Here we go. We're going to get the sacrum, the iliac joint, the sacroiliac joint, and then the lumbar spine up here, L2, L3. Good.
That was another big crack.
Good. Let's see. Let's go face down. Good. And just relax your arm just down with the armrest here. Good. Big breath in, exhale all the way out. Very good. see, let's go face up on the table. Actually, from that position there, scoot forward just a little bit.
Okay.
We're gonna cross both arms, this one underneath. Tuck your chin to your chest. So I'm gonna get kind of where her mid back goes into her low back, because these muscles feel a little tight, and they run down to the sacrum and the pelvis, and can cause some lower back pain also. So
Yeah, I feel some discomfort there.
you do?
Yeah.
All right, we'll get it feeling better. Take a big breath in. Exhale all the way out. We're gonna lean back. Come all the way back. Very good. Just relax. Great.
Oh, I'm getting lots
There
of
you
cracks
go.
out
You
today.
got a loud cracker, yeah. Let's see. Let's go face down here on the table. Now we're going to stretch out the muscles, ligaments, and the joints a little bit while I do some muscle work on her lumbar spine muscles. A dental hygienist, so these low back muscles that kind of bring you so you can lean to the side are pretty tight in her, because aren't you leaning to the side a lot of the times?
Yes,
During the
we are
day?
always sitting down, bending over in our chair.
So her quadratus lumborum muscles feel pretty contracted down here in her low back. You're kind of stiff in here too. Do you get pain here sometimes?
Yeah, a little bit, but it's not as bad as my lower back.
So we're just going to go back, check the leg length again, as you can see here. Looks nearly even. After this, go through, show her some stretches, some exercises she can do for her pelvis and her low back. Do a little therapy on her lumbar spine before she goes. There you have it, folks. It's a lumbar, pelvic, thoracic, chiropractic adjustment. Until next time, it's your Raleigh Chiropractor, Dr. Jeffrey Gerdes. Thanks for watching.